Hi doctor, may I ask you a few questions about the new pandemic?
Yes, of course.
What is the name of the new pandemic? Is it coronavirus or COVID-19?
Corona is a family of a large group of viruses, and we knew only three members of this family. First was SARS coronavirus that emerged in Guangdong, China in 2022, and the second was MERS that emerged in the Middle East in 2012. The third was SARS coronavirus 2 that emerged in Wuhan, China in 2019.
Why they are named corona?
Because the virus from this family looks like it has a crown around it.
What are the signs and symptoms of COVID-19?
Fever, temperature more than 38 degrees, tiredness, chills, difficulty in breathing, muscle pain, headache, sore throat, cough, and loss of smell and taste.
Okay, but there are some words that were said. I wanted to know what do they mean? Like incubation period, infection period, and asymptomatic people.
Incubation period. It is a period that the person takes from the infection until having signs and symptoms, and it ranges from 2 to 14 days. Infection period. It is a time during which someone infected with COVID-19 and can transmit to other people. It begins 2 days before signs and symptoms and end after recovery. Asymptomatic people. They are people who get infected with the virus and didn't have signs or symptoms.
What are the urgent signs and symptoms of COVID-19?
There are 5 danger signs or symptoms of COVID-19. Blue lips, increase the rate of breathing, shortness of breath, pain in the chest during breathing, waking up during sleeping with the shortness of breath.
Are there any risk factors for COVID-19?
Yes, there are many risk factors for people who get infected with COVID-19. People who have diabetes, people who are obese, people who have heart disease, kidney disease, liver disease, hypertension, or the people who have any kind of disease in the lungs, and people who have weak in the immune system.
All these are from the risk factors. How can COVID-19 kill a person?
If the lungs of the infected person cannot breathe or cannot recover, or due to lack of oxygen in the body that can cause damage in the organs.
Is there any treatment for this virus?
There is no specific treatment for COVID-19, but there are treatments to support the body's function until recovery.
What should we do, doctor, to prevent infection with this virus?
First, wearing face mask in indoor places. Try to stay at home as possible as you can. If you get infected, you must be in contact with a doctor. I hope I could help you with these answers. Thank you for watching.